Hi, this is Carissa Caramanis O&rsquo coming to you from the National EMS Culture of Safety Strategy Conference in Arlington, Virginia. I'm here with Vince Robbins from MONOC. Welcome.
Thank you.
So tell me a little bit about MONOC and its mission.
Sure. MONOC is a nonprofit hospital cooperative. We're based in New Jersey. We have about 15 hospital members. So we basically provide emergency medical services, regional operations on behalf of those hospitals to about 2.5, 3 million people in the state of New Jersey.
Wow, okay. So what kind of priority does MONOC place on safety as far as, on a daily practice and what you're bringing today to the meetings?
Sure. Well, being hospital-based, having hospital owners, safety, particularly patient safety, is very important to us. Hospitals over the last decade or two have gone through kind of a resurgence and review of how they take care of patients, make sure that they're treating the patients not only good clinically, but in terms of providing a safe environment for them. Being on the outside, if you will, pre-hospital care, providing emergency medical services, we're also very attentive to the safety of our patients as well as our employees and the emergency conditions and environments under which they operate. So we're keenly aware of safety issues and its importance to providing both good patient care and protecting our workforce.
So what do you think are some of the unique lessons that the clinical space and the hospital experience can really bring to the folks that are sitting down at these tables, really trying to shape the strategy for a culture of safety?
Well, we think it's very important that, particularly in institutions, there tends to be drift associated with employees and how they take care of patients. They become so concerned about directly caring for patients in terms of providing good medical care, they begin to forget about the environment of safety and what's good for them as themselves as caregivers as well as their coworkers as well as patients. So we kind of need to always refocus on what's important in terms of maintaining a culture of safety in hospitals and in the pre-hospital care environment as well.
And are there some simple steps that you have taken that perhaps will apply to some of these broader efforts as far as starting to change some of those behavioral elements to cultural shift?
I'm not sure if there's any simple steps, but there clearly is a need to have to refocus on a continual basis. This drifting I talked about before is something that occurs probably in all industries when it comes to safety. We become complacent and used to the way things function. When we make a mistake and there's no immediate ramification, if there's no negative outcome, we begin to think that's okay subconsciously and begin to do it again and again. Our behavior gets a little bit more risky as there's no negative consequences, and then unfortunately it'll resolve at some point down the road in a catastrophic event, and it wakes us up and then we decide we need to do something about it. So really, to me, the key is to continually refocus on a regular basis. It has to be ingrained. That's why here at this conference we call it about a culture of safety. We have to get employees to understand that when they're out there providing the care that they provide, it's really about the culture that they work in, the society, if you will, of caregivers that they are. It has to be ingrained. It has to become part of them. It has to become second nature.
Mm-hmm. And do you think there's a balance that needs to be struck as far as some of the punitive elements versus, almost more of a rewards-based type environment so that folks really feel ingrained in that culture?
Absolutely. I think with any kind of modification of human behavior, there's always the element that there are some among us, unfortunately, who will act in such a way that the risk they take is just egregious. It's way out of bounds. It's completely inappropriate, and it really borders on them disregarding everybody and everything. Those need to be dealt with in a punishment way, punitively. There needs to be ramifications. The individual has to suffer those, unfortunately. But I think for the vast majority of us, it's the other. We just need the constant reinforcement and reminder, and that can be done in very positive ways. There can be rewards. There can be other positive mechanisms that we put in place to make sure that it reminds people that they need to do the right thing all the time.
Again, this is Carissa Caramanis O&rsquo coming to you from the National EMS Culture of Safety Strategy Conference in Arlington, Virginia.